start a recording. And what I want to do as a kind of initial discussion is really to start with that case, because can everyone see my screen?
Yeah.
So this case I wrote because in a way it summarizes in some way, shape, or form probably a large percentage of the patients that we all have seen and see on a pretty regular basis. And you know, if I can teach you, and some of you may have already unraveled this entire case, but if I can teach you how to systematically work through a case like this, and more importantly, understand how all the pieces come together, because that to me is the most critical part. It's not just understanding one or two pieces, it's understanding how all the pieces are coming together and what piece is affecting what, and really in what priority. And if you can get to that level and understand all of these different elements, I believe that is where your treatments, there we go, your treatments will become, you know, most effective, because of the fact that, sorry. Uh-oh. Well, what is going on here? There we go. Will be most effective because you're really integrating the treatments in a really surgical fashion. And that's one of the things that I've learned over time. And that's the conversation that I want to have with you. So does anyone want to start running with this case and open up the discussion of what you see in this and how you are all understanding this case at this time?
Looks like there's probably at least some kind of a zinc issue, some mineral issues, probably some yeast issues here.
Okay, absolutely. I would agree with all of that.
I would agree with all of that.
Hi, I'm Elizabeth.
Hi, Elizabeth.
Sorry. So I was just noticing that we don't know a whole lot about his family, and that was the first thing I started thinking about. We know he's sweet and that he has poor immunity, but I'm curious about his family system.
In terms of the social dynamics?
Hmm?
Let's say the social dynamics are actually fantastic and the parents are, you know, kind of at the top of their game and they're doing everything you could possibly ask for.
Okay. Okay. He looks like he has allergies to me.
Mm-hmm. He does. Now, the question is, why does he have this, and what was the first thing that set him off? And I don't know how many of you see this picture where your kids that have the poor immunity and all of the issue also have this history of difficulty nursing, they're colicky, and when you kind of really probe down into it, there's a lot of things that pop up right after birth.
Do we know the birth history?
That you all see, or?
Yeah, definitely. I was thinking, which I had written, you know, mitochondrial issues to begin with because of the poor nursing, and then the delayed milestones, and then, but it could, you know, it's also very colicky. So I don't know which comes first, which comes second, you know, in terms of if there is, or does it happen at the same time? That's where I always get caught up, is it's the primary, if there is one.
Perfect. How many of you would say that there is a mitochondrial issue, and how many of you are even comfortable, you know, saying that you clearly understand what the heck that means?
Not comfortable, but likely it's there.
Okay, fair. Yeah. So it actually, you know, over time, the one thing that I've come to realize is that the mitochondria play a pretty huge role in the systemic functioning. So Caroline, I appreciate what you brought up, and there's a lot of things, and this is one of the things we'll get into in a future time, but the mitochondria are probably one of the fundamental kind of foundational pieces of the human organism that we don't really look at. I know in functional medicine, they talk about energy metabolism and mitochondria, but in terms of its impact on the various organ systems and how that ultimately causes a cascade of other events, because these adult docs aren't looking at it from a pediatric lens, they don't really paint it in that light. What do you, so what's another reason why this child would have difficulty nursing and be colicky?
Could be
What's that?
What's that?
Oh, I said,
it could be an or esophageal, like EOE,
a tongue tie.
tongue tie.
Yes, absolutely. So tongue ties are way more common than we realize. And a lot of guys, let me ask you one thing. If we could mute, and then if you want to just jump in, unmute, so we kind of limit the feedback that's there. But tongue ties can definitely play a part. And the thing that I've realized over the last few years in working with some very smart people that, you know, focus entirely on the mouth, and one or two of them I hope to get actually on and have them speak with you. Tongue ties are actually a really big deal, and I think there's a lot of kids who are overlooked. And I've seen, you know, 12-year-olds that present to me with this kind of a picture and ADD and anxiety, and when you trace it back, it's all actually because of a tongue tie. And when you look at also the cranial nerves, so you also have to think about what is innervating the mouth, right? So it's not just this tie that's limiting the structure and function of the mouth, but what is the innervation that's coming in, and how is that innervation ultimately impacting this child's ability to eat? And there are times that lip ties, tongue ties actually start causing innervation. So they cause the distortion of the cranial nerves. And that actually causes these kids to become colicky. And one of the things that's really interesting, I don't know if you've differentiated this in your patients, but there are some babies that are born and they're colicky from like day 1 or 2. And then there are other kids that are fine for the first week or two. There's really nothing going on. And then suddenly week 3 or 4 is when all hell breaks loose. Have you guys seen that? So it turns out that those kids that are born and are colicky right from the get-go are actually kids that have an imbalance in their vagus nerve. And because of restrictions from birth, and there's a really cool book called Accessing the Power of the Vagus Nerve or something like that. And Ben Shields is one of the co-authors, who I would also love to get for him to come and talk to you. But some of these kids actually have an imbalance in their vagus nerve, which actually causes an imbalance between the sympathetic and parasympathetic tone. And when that happens, oh, sorry. There we go. When that happens, you end up getting this very strange scenario where these children can never go into a true sympathetic, parasympathetic rest and relaxation. So when you look at some of your patients, this colicky, they have to be bounced all the time, they have to be rocked all the time, that never goes away. And if you start really looking at and asking the parents, like, okay, so he was like this, what was he like when he was 2 or 3? Oh, he couldn't sleep worth a darn. You know, like we had to do gymnastics to get him to calm down. And now this kid is 6. So there's so many different things. And part of why I did this case is when you look at Ronnie, he may have a tongue tie. If he doesn't have a tongue tie, he has some kind of other structural issue causing an imbalance in the cranial nerves. He does have a mitochondrial error. And that is part of the reason why he didn't have enough tone to crawl. And when you look at this picture, what starts coming about is, well, absolutely he has zinc deficiency, he has digestive problems, and he has food intolerances, and he has allergies, because I mean, there's no human being on the face of the planet that if they don't know how to eat, if I say their eating mechanism, if their eating mechanism is distorted, and a lot of these kids by default will go to very soft textured foods, which is gluten and dairy. And I'm sure some of you have seen this exact picture where the kid is only eating 2 or 3 foods, and every time they come to be forced to eat something else, they freak out. But that is all there for a reason. And if we can understand what that reason is, that is where things start really unraveling. And a lot of this stuff I've learned the hard way, because I've had cases where I'm like, just get them off gluten and dairy and do it at all costs. And then, next thing I know, the kid is throwing a tantrum and the parents just give up, and then they just disappear from my practice for a year because they just completely bombed. And I was the cause of that. So, a lot of these things that I'm sharing with you is not, is by me stepping on landmines and saying, okay, well, that wasn't a really good idea. That was not the smartest thing I've ever done. And through that, it's forced me to ask questions. And Kamyar is probably the one that really forced me to ask more questions than anyone else. And at the end of the day, after 4 or 5 years, what he did was really push all of us to think so much about how we perceive and understand the cases before us, that through that we started reconstructing how we view the children. And part of what was really interesting about working with Kamyar, so I was about 6 or 7 years in practice when I started my training with him, and I had a pretty decent handle of pediatric medicine and functional medicine. And he threw me into such a tailspin that literally for a year, I'm like, oh my God, am I going to harm someone by doing what I was doing before? And this is after doing all of the IFM courses and all of that. So, hopefully I don't do that to any of you, and I certainly don't want to do that. But I really want all of us to start questioning, how is it that we view the children? And when the children come and present to us, what is it that they're telling us? And I don't know about you, but like in our practice, we have this 8-page long questionnaire. And if any of you want it, I'm totally happy to share it with you for you to integrate as you want. But part of why we have that questionnaire is it starts raising flags before I even encounter the family. And, through that, there's a lot of things like, was your child colicky? Did your child have trouble nursing? Blah, 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 blah. And through those yes and no's that they answer, it starts painting this picture of, was there a structural issue early on? Were there other problems happening? And how do all of these really come to set the stage of why this child is where they are now? Does that make sense? So part of what I really hope to do for all of you is not just have this discussion of how do you use this plant for this one scenario. If your kid has allergies, do you use ribes? Do you use agrimony? Unfortunately, it doesn't work like that. And, part of why I say that is I actually tried doing exactly that. Oh, this kid has allergies. This plant is an antihistamine. Let me just use absurd amounts of this plant to try to fix it. And sometimes it would work like 20% of the time, and 80% of the time it was a complete bomb. And part of why it was a bomb is that child had another reason for having the allergies or poor immunity or digestive issues. And part of what I have come to learn over time is when you can understand, sorry, I'm trying to let someone in and my computer's acting funny. So as we come to understand the whole picture, really the full picture of the child, and we come to understand what led to what, which then led to what, which then led to what, then you can say, well, this kid probably has this issue as their primary thing. Let me first address that primary thing. And then as that opens up, you go into other areas. Some of these kids, once they get 1 or 2 cranial sacral or osteopathic sessions, all of a sudden, like 40% of their issues go away. And with some of these kids like Ronnie, for instance, I don't even really touch their gut or food issues first. I get their mouth working, I get them eating, and just getting them comfortable with eating. And I'll tell the parents, like, look, it's going to take a while, give me 6 months. We do some prebiotics and other things to shore up their gut. But then as these kids start integrating new foods, half their other issues go away, and me having to chase after the digestive tract and, getting rid of Clostridia and trying to chase after Candida, all of those things actually start shifting on their own. Any questions? All right.
Well, I'm not a functional medicine doctor. I'm just general pediatrician, been practicing for 28 years, and I have an interest in functional medicine. But this story just reminds me a lot of my daughter, who's 26 and was found later on to have autism spectrum disorder. I know that's just kind of a catch-all term, and there's probably more to it than that. But I just noticed we hadn't mentioned anything about that up until this point.
About the autism spectrum?
Yeah. Do other people see similar? I mean, this is her story. This is it right here. You know, and I just think it's interesting.
So we'll touch on that, because there's actually a movement that suggests that, you know, and I absolutely 100% believe in this, and this entire Holistic Minds venture that I'm launching is a way to address that. There's probably a really good chance that 20, 30, perhaps more % of kids that are labeled as autistic actually have errors in sensory integration. So their ability to process their world through their sensory systems and organs are actually distorted. And the reason why they are in a state of distress is because they're constantly overwhelmed, because their senses just kind of flood in all of this information. Their sympathetic, parasympathetic tone is off. And then on top of that, they have adrenal issues, thyroid issues, metabolic issues. And that combination is just way too overwhelming for the human organism, and they struggle. This thing of sensory, you know, has all kinds of sensory sensitivities, hates tags, gets overwhelmed. These are all signs of a sensory processing disorder. It turns out that sensory processing disorders to some extent are grounded in the cranial nerves. So when you look at, like, for instance, the middle ear, how do we regulate sound? How do we regulate the volume of sound? It actually is a muscle, right? And that muscle is innervated by a cranial nerve. It turns out that sometimes when these cranial nerves are slightly imbalanced, and there are people way smarter than I that can explain this, and at some point I really hope for them to come on and have this conversation with you. But there are times, and I've seen this multiple times, where these children, once they get 1 or 2 sessions, all of a sudden their way of processing the world changes. So there are reasons why these things happen, and it's not just by happenstance, but the sensory sensitivities are kind of the final stage of the other imbalances that have built up over time. And that's why, you know, I'm sorry that your daughter is this child, but I see these cases all the time. And part of the complexity and really the beauty of cases like this is for us to unravel what came first, and then what tipped something else into an imbalance, and then how did that tip something else into an imbalance. And that's really what happens with a lot of these children. You know, there's one issue, they kind of compensate, that issue starts creating another issue, they compensate for that, and then finally they get to a point where they just can't compensate anymore because there's so many things that are out of balance.
And you're saying the first step is really to get some craniosacral adjustments.
Yeah. Or, you know, your daughter at the age of 26 may have a tongue tie, And I've been humbled enough to realize that, you know, after 2 years of studying them, I still completely suck at identifying some of them. I know how they manifest in terms of the clinical symptoms. Ask me to look in someone's mouth and diagnose it, and it just goes right over my head. But I know how they look and feel. I know how it limits the functioning. And, you know, there's things you have to do. And there's some very smart dentists that I can ultimately have come on board where all they do is this. But, like, there's a posterior tongue tie that actually can create a lot of these different issues. And, you know, there are some craniosacral and osteopaths that are sensitive enough where they can feel, and they're like, no, this tongue is tied. I can't do anything until you get it released. So it's a matter of understanding how all of these pieces can look. And, you know, does this child have a tongue tie? Is it a cranial restriction from birth? Is it both? And by asking these questions and really at least getting to that point where you ask that question, and whether you find the answer right away or it takes you a year, at least you've asked the question and that idea is in your head now. then that starts opening up doors of possibilities and opportunity to help. And that at the end of the day is really the most important thing for all of you to start asking questions about, is this a possibility in my patient? Is that a possibility? What about this? And, you know, initially you'll see all of these questions just almost rushing in and borderline overwhelming you. But over time, as you keep asking the questions and you see the answers show up in your patients, then it becomes easier and easier and easier. And then it becomes almost automatic where the questions just quickly get processed in your mind. And that's really what I want to help all of you do for yourself. And that's what Kamyar did for me. So really, there's two things that I hope that we can achieve at the end of this. One, to really understand at a holistic level how all the systems come together and how they impact one another. Because without this, any tool you use, whether it's a plant, it's craniosacral, nutraceuticals, pharmaceuticals, it really doesn't matter. Without this, you ultimately cannot see truly what tool you need, and you're just kind of shooting in the dark, hoping you hit something. And sometimes it works, you know, it's not to say it can't work, but the degree of precision and ultimately your efficacy are impacted by the tool you choose, because you may not be choosing the right tool if you don't understand how everything comes together. And then that secondary piece of, once you understand how the pieces come together, then you can say, okay, I'm going to send this person to a craniosacral therapist, or I'm going to choose this plant, or, oh my God, this person needs surgery. So the tool becomes really a secondary piece of your understanding of what they need. So this is a question that I think all of us should be asking. And I'm sure the answer is kind of obvious, but this is where, honestly speaking, I have a little bit of a problem with functional medicine. Because when you look at functional medicine and you look at ultimately Jeff Bland's brain, you know, he's a biochemist at the end of the day. And functional medicine is really the most elegant and incredible use of biochemistry that I've ever seen. And, don't get me wrong, I love functional medicine, and it's about at least 50–60% of what I do. But one of the things, the qualms that I have with functional medicine is it takes the intelligence of the human organism out and treats the human organism more as a chemistry set. You know, if you just pump the organism full of enough probiotics, you can fix the gut. If you bombard the system with enough folate and B12, you'll change this pathway. You know, give enough magnesium, give enough B6, whatever it is, to change these pathways. And it's not to say that these things aren't true, but the first thing we need to do is say, well, is the human organism intelligent? And does it have the ability to manage itself and try to compensate when there are imbalances? And the reason why we need to ask this question is, if you can ask this question and then understand what is the human organism doing and what are the compensations that it is making because of whatever imbalance or host of imbalances, then you can start working with what the human organism is actually trying to achieve. And this is where, you know, if you look at what acupuncture does, what homeopathy does, what osteopathy does, what Ayurveda do, all of them really talk about first understanding what the human body is trying to do and how do you actually aid in supporting the body. So you take away the restriction, which is what functional medicine does. And there are things you do to support the system, but you first have to, in a way, start talking the human body's language. And weird signs and symptoms that show up, which may seem completely irrelevant, may actually be the most important pieces of information that the human body is trying to communicate to you. So I want to bring you into my sandbox, as Kamyar did with his. So these are the plants that we have in our office. And you can see we've got a bunch of stuff. We've got a lot of essential oil, gemotherapies, mother tinctures. And at the end of the day, I'm more than happy to share with you as much as you want about these plants. The way I see it is, after now, 6 or 7 years of using them, my use of these plants has dwindled down to maybe like 20 plants I use on a regular basis. And those are the ones that I want to focus on. But part of why I'm sharing this with you is, even though I have all of these plants and all of these tools, understanding how these plants and these tools are used and when they should be used in what context is what's going to help you produce really the best results for your patients. So let's just look at this very simple discussion, right? So you've got a kid that's just freaking out and losing their mind on a regular basis. And this could be the 3-year-old that's, you know, throwing tantrums and, you know, losing it, or the 15-year-old that's now diagnosed with anxiety disorder. And when you kind of look at it, they're, in a way, they're kind of the same in different ways, right? But at the end of the day, what would our initial reaction be? So this is part of why I bring this up is, you know, 7 years ago, my initial reaction was, well, let me just throw enough Roman chamomile, or if you want to get really fancy, something like neroli or lavender to calm it down, right? If a kid is having an issue, part of what we want to do is address their issue. But would everyone agree that that's kind of what may be a way to go? Except it takes us back to, what if the things that are there is there for a reason? Like, the human organism is causing this child's nervous system to act in a very strange fashion because of the fact that there's actually something going on that underneath this. Does that make sense? So really what it boils down to, and I honestly 100% believe in this, that everything in the body happens for a reason. When you see some kind of outward symptom manifestation, whether it's sensory processing disorder or anxiety or poor immunity or whatever else, all of those are happening for a reason. And every complaint that the family has, and you know, there are times the family's like, with the 12-year-old that I was telling you about, the tongue tie, you know, it was our 3rd session together, and I just could not get her anxiety or her immune issues to budge. Like, we had tried everything under the sun, nothing was working. And, you know, we were just chatting, and I was like, just tell me more about her. Tell me what, you know, anything and everything that comes to your mind. And we were talking, and then the mom, after like 10 minutes, she's like, yeah, and it takes her 45 minutes to finish a meal. And this is a 12-year-old. I'm like, that's strange. So tell me more. And then she started telling me about, like, yeah, you know, she really can only handle these kinds of foods and blah, 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 and blah, blah, blah. And it turns out that this 12-year-old actually had a tongue tie that I had missed the first 2 times. It had not come up. And the mom initially didn't even think about sharing that with me. And I hadn't thought about asking, like, oh, your daughter's, you know, diet is kind of weird. How long does it take her to finish a meal? Because that's not what you typically ask, you know, in the first session. But the point is that everything can tell you something, and it's sometimes the most seemingly irrelevant complaint that is actually the most relevant. And the smallest sign that may be seemingly totally disconnected with what they're presenting for may actually be the main reason why they're having the issue that they're having. And that's why I really love this quote from A.T. Still, where every variation of health has a cause and a location. And ultimately, it's our job to locate it. So we have to understand what the heck it is, and then get rid of it so we can allow health to be restored.
Surprisingly, actually.
So at the end of the day, we all are detectives, right? I'm sure you know this is your job, and all of us that have been practicing long enough, that's what we feel like. But this is where I really want you to sit and reflect, because a lot of times, and I feel that functional medicine, you know, without talking too much bad about it, is really more about how do you sock your way, you know, and punch your way to a state of health, right? You use as much force as you need sometimes to nudge the system, force the system back into a state of health. And what I want to suggest to you is that a more efficient way to actually handle this is more what the martial artists do. If you can channel the energy of the human body, if you can channel that healing force, which means you have to understand what the heck it is that's going on inside the body, then with very, very little force, with very little energy, you can actually cause pretty profound changes within the human organism. We already touched on this. So let's talk about the adrenal glands as just one example. How familiar are you guys with the adrenal glands? I'm sure you all know what it is, but how much time do you spend thinking about them? And how actively do you address them on a regular basis? So I see some nods. I see some people shaking their heads.
I wanted to throw something in here. One of the things that I do with my patients is we look at their axillary temperatures over time. And one of the profound things I find, especially in children that have any kind of developmental issue, is that they have oftentimes, instead of, we use 98 as a baseline, approximately 97.8 to 98.2 in Fahrenheit. I guess that's 36.6 or something centigrade. And we find kids that are 94, 93, 92. And so I tell people, I say, well, why is that important? Well, number one, it tells you that the adrenal and thyroid glands, to some extent, the metabolism is working properly. And the adrenal has a lot to do with that. And then number two, our bodies are meant to be at a certain temperature, and our enzyme systems aren't going to work right until that temperature is restored. So the adrenals, I think, a very, very big piece of that, and I work very closely with that with a lot of my patients. And if you take it to another level, adrenal glands, the adrenals are under stress all the time because we have a high stress environment today that we didn't have 30, 40 years ago. We were talking about how things were when we raised our kids 30 years ago. We didn't even know half the stuff that's going on today. And now it's just, everybody is just like pouring out information that we were ignorant, we were very blissfully ignorant back then. So the kids didn't have the stress. But now today they do, and they're on their iPads, and they're on, all this stuff is causing the stress, and the adrenal and the thyroid interact with each other. They're so important.
Well said. Well said. Thank you. And I would agree that at least 20, if not 30% of our patients have some degree of an adrenal imbalance. So thank you, Eric, for pointing that out. And the thyroid definitely plays a part, and we'll definitely touch on this. Now, let me ask you or anyone else over here, outside of the external stress, what is another reason why the adrenal glands just kind of putter out? Well, and you know, in the kids, and this is something that it took me a while to try to piece together, because in the sickest of my sick patients, the ones that are most resistant to ultimately responding to treatments, and I still have probably 3 or 4 of them in the practice, these kids I always found to have the crappiest adrenal gland function, and there's ways actually through a CBC that you guys can calculate that, and with Kamyar's blessing, I'll share that with you. But these kids had the crappiest adrenal gland function of pretty much any other people. And it begged the question, well, why were these kids having such crappy adrenal gland functioning? Why do you guys think that the adrenal glands would really putter out in some and not so much in others?
Diet and environment.
What about the environment?
Toxic exposures.
Absolutely. What else? Toxins are definitely a part.
I also feel like I temporarily muted again. The in utero environment, if they're under chronic stress in utero, they just come out as, you know, deficient right away.
Yes, and I think some of that has to do with the maternal nutritional state. But there's one other thing, and Caroline, you actually touched on it earlier. Go back to what you said about Ronnie.
I'm not sure what I said.
The metabolic functioning. So think about what the adrenal glands have to do. They have to shuttle cholesterol in through multiple different membranes, right? Convert the cholesterol to a totally different compound enzymatically, and then shuttle these new compounds, aka cortisol, DHEA, out, right? How does that happen? It's a intense metabolically dependent activity. And, you know, it took me 2 or 3 years to finally have this aha moment where pretty much all of the kids that I have that have some kind of mitochondrial error or metabolic deficiency, all of them have adrenal gland problems. And what has been really interesting, and I saw this in my own daughter. So if you saw in Ronnie's case, I also talked about how Ronnie gets these dark circles. So the dark circles, which is different than more of the pinkish purplish hue. So the venous congestion is different than the brownish discoloration that these kids get. And the venous congestion, if I can actually talk, doesn't come and go immediately, right? Those are the kids that are chronically congested and they've just got this kind of puffiness and kind of discoloration. Whereas the other kids, if you ask the parents, what did they tell you? They're like, yeah, Johnny didn't sleep last night, or Ronnie didn't sleep last night. And the next morning she wakes up, or he wakes up with, dark circles under his eyes. So that's beta MSH. And beta MSH is one of the ways that the body actually upregulates adrenal gland function. The sympathetic tone is another. And in my daughter, one of the things that was really surprising, and I've seen this in a bunch of the kids, is when I started her on various kinds of metabolic supplements, kind of this mito cocktail, as they say, all of a sudden her dark circles went away. And I didn't have to keep chasing after her adrenal glands with the plants because they actually started functioning enzymatically at a much higher level. So it's little things like this where I really want all of us, and I want you to, ask me and push me, because I'm sure there's a lot of things I don't know. So part of why I'm excited about is to have you also ask questions and bring up suggestions of like, what about this? What about that? And I think through this discourse and discussion, we'll start learning more and more about the human body than any of us know. But one of the things about the adrenal glands is that they actually are dependent on energy production. And the toxins are just one more thing in stress that throw them into a loop. But one of the things that's really interesting is cortisol acts as a negative feedback loop on the hypothalamus and the anterior pituitary, right? All of you kind of know this at least? So the thing that's really fascinating is when you look at these cases, one thing you can do is try to block the sympathetic nervous system, right? Through using whatever calming plant that you want. But to ask the question of why is the sympathetic nervous system really upregulated, if my computer wants to work in the first place, is the part that's most helpful. And when you sit there and you really think about it, why in many cases, and there's a lot of other reasons, this isn't the only way or the only reason. There could be gut issues, there could be nutritional deficiencies, there could be a host of other things. But one of the reasons why these kids end up having a elevated sympathetic nervous system is because they have an adrenal insufficiency. Because the sympathetic nervous system ultimately impacts ACTH. And when you don't have that negative feedback loop because of the cortisol, so when cortisol is deficient, you end up getting this feed-forward upregulation of ACTH, then CRH, and then ultimately the sympathetic nervous system. And when you try to block the sympathetic nervous system without understanding why the heck this child is freaking out in the first place, that actually becomes, in a way, a disservice. And one of the things that I found in some of the patients, I don't know if you guys have seen this, when I was in the mode of bulldozing, I would use absurd amounts of Roman chamomile or lavender or whatever, and the kids would get better for like 2 or 3 days. And the parents are like, oh my God, this is awesome. And then a week later, I get a call. They're like, oh, she's worse. Have you guys ever seen that, where there's almost like this rebound, where you try to calm something down and it works for a few days or a week or two, and then all of a sudden it stops working? So if you've seen that, there's a reason why that happens. And that's the body's way of telling you, like, stop messing with me. I'm doing this because of something else that I'm trying to accomplish, and you just can't see what it is that I'm trying to do. So this diagram is here to depict that sometimes the first thing we have to do is ask, why is the sympathetic nervous system elevated? And where is that coming from? And instead of trying to suppress the sympathetic nervous system, address what it is that the body is actually trying to accomplish. So if my computer works. So if, for instance, you use black currant or ribes nigrum, you can very efficiently actually increase the adrenal gland activity, which then actually causes there we go. A shift in the sympathetic nervous system with much less effort. And a lot of times, for instance, these kids will also have a little bit of eczema or a little bit of what seems like allergies with congestion. But when you think about it, when you give Benadryl, how does Benadryl work to get a kid to go to sleep? Have you guys ever thought about that? What does Benadryl do to cause someone to go to sleep? Any brave soul? So if you look at it, histamine is actually a sympathomimetic. So histamine is part of how we sustain and maintain our sympathetic tone. How Benadryl works is when it drops histamine levels, what that does is it actually drops the sympathetic tone, which is why some people, 80% of the population falls asleep. You give Benadryl to a kid who has a pretty significant adrenal insufficiency, and you drop their histamine, and histamine is one of the ways that we actually maintain adrenal cortex activity. If you actually drop histamine levels in a kid who's really low in their adrenal gland function, you know what the body does? The body says, well, the hell with you. There's no way in hell I'm letting you drop the adrenal cortex activity any lower than it is. So it actually causes a compensatory hyperactivation of the sympathetic nervous system. And that's why 10, maybe 20% of kids, when you give them Benadryl, instead of getting sleepy, they just get crazy on you. So these are the things, when you start looking at this, you'll see these patterns and these things just show up over and over and over again. And all of this information is right underneath our noses if we can actually just step back and look at it. And that's part of what was really cool with, working with Kamiar. When he'd said these things, I'm like, oh my God, yeah. Like, how is it that I never thought about that? So, really, it is a lot more efficient for us to work with the body and help it achieve its goal rather than impose our will or the will of the parents. And I've had families that have come and they're like, I just want you to, make my kid more calm. I'm like, well, it's not that simple. And they're like, well, can't you just give a homeopathic, to calm it down? I'm like, no. And, I've had one or two cases where I just said, you know what, I'm so sorry. Here's your money back. How you want things to work is not how things work. But at the end of the day, what we need to do is understand what is it that the human body is trying to achieve and how do we support the human body in its goals. And that's when we see really cool results happen. And this is just an example. I mean, concentration-wise, 10 drops of Roman chamomile essential oil at a compound pharmaceutical level is astronomically higher than a gemotherapy. And yet giving 10 drops of a blackcurrant gemotherapy to a child who's anxious in the right circumstance will produce an astronomically better result than using Roman chamomile or whatever essential oil to calm them down. So we kind of touched on all of this. And yeah, I don't want to keep belaboring this. And I just included this because, there's so many funny things that when you start really looking for them, show up. So some of your kids, you'll see like they freak out. And I see this in the office, I'm watching the kids and a little thing happens and then all of a sudden their cheeks flush or their ears just turn completely red. And, when you ask a little bit more, like, what happens to your 6-year-old at, 3 o'clock in the afternoon, right after school? Oh, he's losing his mind. That's the worst time. That's his witching hour for a 6-year-old, or they have little bouts of eczema. So all of these patterns are right underneath our noses. And this is really what I want to share with you, more helping you see these things, because once you start seeing them and you'll see these things show up in clusters over and over and over again. The kid that has their ear flush, next time ask them, how does he or she do with changes? Does she have an easy time with different kinds of changes to their schedule? No, they're usually pretty rigid. How do they wake up in the mornings? These kids that have adrenal gland problems, they wake up crabby in the mornings. You know, these are the kids that take a while to get going. There's a reason for that. It's because they can't get that surge of cortisol first thing in the morning to get going, or they crash in the afternoons. I mean, some adults are part of this. So it's really about understanding the picture of your patients in the most comprehensive fashion possible, to really understand what is it about them that's causing them to suffer? What is it about them that's causing them to have their imbalances? And once you understand that picture, then applying the right tool becomes really, really easy. And at some point we'll get into this. So Eric, this is part of my little tool chest. So this is called the biology of functions. And this is part of how through basic labs like a TSH, CBC, plus or minus one or two other things, which you can get through Quest, you can actually start doing calculations like this. And this was one of the patients, you know, and you can see right there, cortisol for most of these kids should be around 5 to 7, and it was a 0.7. So we'll touch on these things, and I just wanted to say that this is all possible. And, you know, then there's other really interesting things. And you stole my thunder, Eric. I was going to get to this, but, you know, the adrenal glands and the thyroid.
Sorry.
What's that?
Sorry.
It's all good. But the adrenal glands or thyroid are completely integrated. And when you have an issue with one, you end up getting an issue with another. And if you've got issues in both, that's when your patients are really, you know, fill in the blank. And there's all kinds of weird things that we don't take into account. For instance, we're so focused on treating the gut, which is great. You know, don't get me wrong. We need to be focused on the gut. We need to be focused on the diet. We need to be worried about, you know, intestinal permeability. But when was the last time you heard someone talking about the fact that TSH and TRH can actually change dendritic function? Just do a search for TSH and dendritic function. You guys will be floored with the information that's out there. When your thyroid axis, when your thyroid system is out of balance, and I think this really highlights what Eric was saying, and, you know, God bless him for already knowing this. When the thyroid axis is out of balance, good luck trying to get the immune system to normalize. And it turns out that if the thyroid axis is out of balance, the kid's sympathetic nervous system is going to be completely whacked out. And when a kid's sympathetic nervous system is whacked out, it turns out that they ultimately, through that stress response, start distorting the bacteria in the intestines. They start having intestinal permeability just from the psychological stress that they're experiencing. So there's so many intricacies, and there's so many different reasons why things can happen. And I just brought this up not to teach you all of this in 15 seconds, but to just highlight how little we sometimes see when we just look at the system from one way. And we'll skip this. So, you know, part of why I'm enamored by the plants is their mechanisms of action are so elegant and they're so incredible. And, you know, to me, like, while nutraceuticals and supplements are amazing, to start having a relationship with the plants is, you know, to me, the most, you know, perfect love affair you can imagine. You know, take, for instance, Clary Sage. It supports the adrenal glands. It has anti-inflammatory properties. It's a thyroid supporter, a fantastic thyroid supporter, as is sage. And Eric, for some of your patients, you know, either Clary Sage or sage for increasing thyroid activity could be a fantastic tool. And when you look at applying something like Clary Sage for that patient, well, you support the thyroid, so you increase T3 and T4, which changes part of the TSH response. Because you're simultaneously addressing cortisol, that then changes everything else that's going on over here, which then changes this. Alpha is basically the sympathetic nervous system. And you simultaneously shift all of this. So, you know, in the right scenario where your child has allergy issues and they have the mood issues and they're crabby in the mornings and so forth, you know, if you did backward somersaults and pumped them full of probiotics and magnesium and all of this, you'd be missing the boat. Whereas if you could look and say, holy cow, this patient has this cluster of imbalances, and Clary Sage just happens to be the perfect plant in this case then all of a sudden you give this kid half a teaspoon of this mother tincture even once a day, you know, and 2 weeks later, the parents come back and like, we don't know what the hell you did, but like all of our kids' issues are gone. And, you know, these are part of why I'm tickled to death about doing what I do. And, you know, what got me to say, hey, is anyone interested in jumping on board, is the elegance with the plants and the way when you know how to use them. So arbitrarily, blindly throwing Clary Sage at every single one of your patients is going to be like, you know, me trying to use homeopathics. You know, it just doesn't work. But when you understand what it is that your patient needs, and then you understand precisely what tool to use when, that's when you get really easy, incredible change to take place. And you get, I'll just touch on this for 15 seconds. And, you know, this discussion isn't just with the plants. It isn't just with the hormones. It's really understanding everything. It's about looking at things from a structural standpoint as well. Because like I touched on earlier, understanding how the cranial nerves impact things and how the vagus nerve, or, you know, cranial nerve 7, and how that impacts tongue movement. Because if, for instance, you've got some issue with the tongue and the tongue is flopping back because of either hypotonia, which has to do with a mitochondrial error, or other issues, and the kid has airway obstruction and they're having obstructive sleep apnea because their tongue is flopping back and their airway is obstructed because of that, well, yes, the kid is going to have all kinds of issues. They're going to have problems with anxiety. They're going to have problems with poor focus and attention. And like I touched on earlier, they'll have issues with just about everything else because they're not sleeping. And let's see here. So, yeah, this is my, and some of this I have to say is probably inaccurate now that I've gone back. So, you know, we focus so much on this link of how the gut affects the brain, but when was the last time we started talking about how the brain affects the gut? And, you know, in future talks, one of the things I want to do is just talk about what happens to the gut from all of the external factors, from tongue ties and eating problems to chronic stress. Because if you just do a search for chronic stress and, for instance, Clostridium, Candida, E. coli, all of these, when there's epinephrine and norepinephrine in elevated amounts, actually start growing. Clostridium actually becomes aggressive and starts changing certain enzyme pathways within the cells when there's epinephrine found in their environment. But we don't talk about this. So if a child has another reason why their nervous system is elevated, that can then impact the gut and change the gut in its function. Let me do one thing here. So, you know, looking at this and looking at how structure impacts function, and how does structure in our physical body impact the brain or the gut? How does energy impact our muscles? And all of these links just keep going and going and going. And this isn't to confuse you. I really hope you understand that's not my goal. It's really to talk about, this is how the human body functions. This is the true picture, at least in my best attempt to depict it, to show how you can have an imbalance in one area, you can have an issue in one area, and that can tip everything else out of balance. And asking the question of what came first. And you can see, like, if you have a tongue tie or some kind of issue structurally, that can ultimately set off an imbalance that distorts something else, which then distorts something else, which then distorts something else. And then, you know, the 10-year-old that's showing up with congestion, allergies, immune problems, and you're focusing on the gut, but the gut was the tertiary thing that went out of, you know, out of balance. Ultimately, you can't get very far. No. And then this was the psychological game that Kamyar forced us to play, which is how all the hormones are integrated with one another. So that's it. That's what I want to touch on right now. And really, what I
Jason,
want us to do as a
can
group,
you get Patty so I
have the
can go to the room?
discussion. Okay, so we're hearing someone. If we can mute ourselves, please.
You know, you can mute everybody. You can mute everybody and just allow them to unmute
Let's
themselves.
see here. My controls are acting funny. Hang on for 1 second. Let me see if I can figure out what my computer is misbehaving for some reason. Oh, we're good. So at the end of the day, what I really want all of us to do is to start standing back and just asking the questions of what are the things that cause our patients to suffer. And what I want to do is systematically, one month at a time, to really open up the conversation of how does the structure impact the human organism? How do basic hormonal imbalances impact the human organism? How does mitochondrial functioning impact the human organism? And for us to start this discussion of how each system impacts other system and how do these imbalances show up, and how do you then system by system start piecing things together to really make a difference for our patients. So that is my goal. That is what I want to give all of you and what I want us to have as a discussion. Now, this also means that all of us, all of you are actively involved in this, because a 1 hour discussion once a month is not going to do anything for you, because half this information may, just kind of fall through the cracks. So really preparing for the discussion and all of you actively thinking through, well, how does this play? How does that play? So by the time we get to the point of having our discussion, there's already been a lot of thought that has gone into it beforehand. I think that will be critical for all of us. And, hopefully we'll open up new doors of understanding that I don't have. That's it. Questions, thoughts?
Thank you. This is excellent.
Thank you. Thank you.
So I have a question.
Sure.
So talking about tongue ties, I feel like everyone in my family has a tongue tie, all the kids. And so I have two questions. One is, why is it so prevalent? And then the second one is, if they're older, like 10 or 3, or, is that the first thing that you do, or is that the last thing that you do? How do you order that intervention as far as, is it a clipping? Is it craniosacral? How do you order that intervention if there's other things that's already happen, like, picky eating and allergies and asthma and tantrums? Like, where do you put it on the treatment list?
Great question. There's a lot of debate about, are tongue ties happening more often, which I think they are. I think there's some kind of environmental factor that we're just not smart enough to recognize. And there's some very smart ENTs that agree that the prevalence of tongue ties has probably increased in comparison to a decade or two ago. I think we're also getting smarter about identifying them. And there's a lot of debate, especially in the literature, that especially some of the posterior ties are not real. And I would say that, before 2 years ago, I would say, well, yeah, how can you have a tie that you can't see? Until I had some of my trickiest patients get their release, and I was floored. In terms of prioritizing, there's some preparation that needs to happen. So through craniosacral work, if any of you happen to have access to these people called myofunctional therapists. So these are people that are just highly, highly obsessed with the tongue, and it's crazy. That's all they do: tongue eating and tongue movement. So what these myofunctional therapists do is actually start mobilizing the tongue and getting the tongue activity to improve. So when you do the release, you don't get reattachment, which is actually something that happens fairly commonly. So and these are things that we can talk about, and hopefully I can get someone much smarter than myself to actually come and talk about this, so they can share with you, how do they do the tongue releases, why we want to prioritize other things. But generally speaking, I do have kids get craniosacral work, and if there is a myofunctional therapist available, have them work with that person for a few sessions before they get the release.
And do you see symptoms improve? Like, if they get it done at 10 or 15, do you see that things actually seem to get better? Or does
Absolutely.
it take, I'm assuming since it's been there so long, it probably takes a long time for things to start to improve.
Well, I mean, long time, if you consider 6 months for someone who's had, you know, a lifelong list of problems, I would say 6 months is actually a short period of time. And that is part of, you know, what I have learned to do is to set the expectation. So for some of the families that come in, I'll tell them flat out, like, look, these are the things that are going on. These are the things that I can address now. These are the things we need to work on. But to get that full, you know, release and to get the entire system to really function at a very high effective level, we need to do these things. And that's going to take time. And I think, you know, you also have to feel out your audience. There are some people that, you know, may not be comfortable with one thing. So you start with a very simple, you know, intervention in one area. You give them adrenal support, you know, and oh my God, my kid is better and they're not flipping out every 2 seconds, you know, and once you kind of open up that bridge and you get them past that first hump, then you go after something else. And in the back of your mind, it's like, okay, when do I bring this into the picture? So there's different ways to navigate. And some of that also has, you know, to do with the family you're working with. You know, there are some families that come in, they're like, just, I don't care what it takes. You know, if you have to fly to the moon and back, we're done with all of this suffering. My kid is flipping out. They're about to get kicked out of school, or they have, you know, a million different, you know, digestive issues that haven't improved in 2 years. Their pain point and tolerance is going to be different than someone who's like, well, you know, my kid just has a little bit of ADD. And that's the only thing they're paying attention to. So it's really, to some extent, also understanding our patients and their families and who they are, what they expect, what their resources are, what their ability is, to kind of prioritize where you go. Bless you.
I wanted to throw in a couple things here. One thing I think that's real important that you mentioned earlier, the way that the body works together. You don't always have to have a specific right answer to anything, because the body will start correcting itself if you miss something in many cases. Now, sometimes there's a critical piece like what you're talking about. When you mentioned we've been talking about the glandular structures. I went to a conference a long time ago before we even knew about things called endocrine disrupting chemicals, or the EDCs. And they were talking about how the animals around the polluted Great Lakes were having all these tumors all over everywhere. So when you talk about maybe having more of this or more of that, what I'm seeing a lot of in my practice, I never saw 30, 40 years ago, I've been doing this for a long time, I'm seeing a lot of hypospadias and 4D that I've not seen before. I'm not sure why. I think it has a lot to do with that. I've seen a huge amount of Hashimoto's. We're seeing a lot, of course, of autism and different things like that. And I think a lot of this has to do with our environment, and chemicals, and detox is a huge part of what's going on here. We're not eating right. We're eating, you know, GMOs, and we're eating chemically laced foods, and the sugar is a huge problem with the adrenal glands. So there's a lot of different pieces, and once we start working with improving the milieu of the child, and a lot of times the body will start doing what it has to do to integrate things and put everything together. And sometimes it does take a team. It takes a team approach. It may take a craniosacral therapist, or I'm very interested in myofunctional therapists. Never heard of that before. I've heard of myofascial therapist. I don't know if that's the same thing. But it oftentimes takes a team, a group of people that work together in different ways to really affect the ultimate outcome.
Absolutely. Thank you for touching on that. Any other questions?
Just had a quick question. And first of all, thank you for being willing to do this. It's super helpful, especially being fairly new to a lot of this. But just in order to prepare and try to be more conversational in this, is there any resources that you could email the group, or anything that you would direct us to read and kind of that dig deeper into a lot of this for?
Yeah, you know, part of what I'm going to do, so there's a part of me that is, and if you guys agree, I want to actually start with the structural kind of piece of this discussion, because it seems, at least from the questionnaire that you filled out, that that is probably our greatest area of deficit collectively as a group. So I'm thinking of us starting there, but let me think about this a little bit more, and I'll post it to the forum. So what I want to do between now and the next time we meet in about a month is to basically start presenting to you books and articles and various other things to read and check out. So you start kind of priming your thoughts and really formulating your thoughts depending on what it is. Like there are certain articles in one area that I'll share with you. So give me a little bit of time to process. And would you agree that we start with the structural piece? Does that sound reasonable? Or do you want to start with the mitochondria? I think that's another really big area for us to explore.
Seems like either way, those are both pretty foundational. So I'm good with whatever.
Okay. So in the next few days, let me just think about this a little bit more. And then I'll post to the forum, different discussions, whether it's websites or articles, or there's one or two books that we may want to explore. And then we'll use that to kind of jump into the discussion, and then from there we'll keep evolving the discussion on the forum, and then have the online discussion to kind of wrap things up and gel it for you.
The question on the structural.
Yep.
Is this? I don't know exactly where you're going with this, because I've partnered with people that do it: chiropractic, craniosacral, neuromuscular, all kinds of different things. But it's not something I really have hands-on ability to do. Is that something that could be taught in a forum like this?
I frankly suck at the structural piece in terms of treating. Like I would never touch a patient. I tell the people, like, I'm an osteopath. You do not want me treating your child. There's a lot more competent people out there that actually do the work. I know how it looks. I know how to find the restrictions. And I think for you at a sign and symptom level to be able to recognize when restrictions are there, you don't even necessarily have to lay hands on them. But between that and then partnering with, one or two people that you're comfortable referring to, they then become your eyes and ears, and they can feed back to you, yes, this is going on, that's going on. And your patients will, a lot of times once you start knowing how to identify these things, when you send them for a treatment to the right person that is actually competent and able to pull off what it is that they need, then your patient will, call you a few days later and say, oh my God, like my colicky kid is no longer colicky, or this X, Y, or Z things happen. I don't expect any of you to be able to do the treatment. And, the treatments are really an art form. And the way I look at it, you want someone who is obsessed with body work, and all they do every day, all day, they sleep, dream, body work. And those are the people that are generally way better at it than someone like me who kind of muck around on the side. Anything else? Anyone else? Okay. Well, thank you all for joining. This was a delight, and I'm happy to see all of you here. So I'll post a video on the forum in case any of you want to review any of this. And within the next few days, I'll create a new topic, whether it's the structural piece or the mitochondria. I'm thinking more of the mitochondria because they actually impact the structural piece. But let me sift through, and based on the questionnaire that you guys filled out, let me go back to that and really see how to prioritize all of this, and then we get going. Great. You all have a wonderful weekend. Okay.
You too.
Bye-bye.
Hey, Sean, can we still invite people to this group?
Thank
What's
you.
that?
Can we still invite people to this group? How do we invite people?
Have them, so if you want to use my email and then just CC them.
Okay.
And then, yeah.
Are you
All right.
trying to keep it down to a certain number of people? Because I can just imagine that this would be thought-provoking for so many.
I think at this stage, I don't have a maximum number, because as long as, we're a cohesive group, and that's really what I want more than anything else. I want a group that is, comfortable interacting with one another, because you will learn a lot from each other just through your interactions and questions. And that's why I really want to encourage all of you to take advantage of the forum. So as long as the group stays cohesive, if it starts ballooning out to, 100 people and we lose that, then at whatever point I would stop the growth, because the people that are here and, those of you that have joined early on, I really want you to get a lot out of this. And hopefully, in a year's worth of time or 6 months, I haven't even figured out how long we're going to go for. I want you to walk away and really feel more confident in the way you're able to approach some of the more complex patients you have. Cool. All right. Have a wonderful weekend, everyone. Bye.
You too. Thank you.
You're welcome.
Thanks again. Nice meeting you.
Likewise.
Likewise.